I get this question like 10 times a day, every day. So I thought I would go ahead and just put something together. And when I was doing my research for this topic, I said, wow, we could go on and on and on and on, because there are so many different ways and so many different ways we could take this. But we don't have all day. So I put down the highlights, what I think can answer some basic questions. And then that will be a stepping stone in your research and how you go about this. And I must make a disclaimer, I'm no expert in that. You know, I had to sit through a whole course at our meeting, one of our big MS meeting a few weeks back, just to get more information. So don't hold me to anything, okay? But at least what I've put together, as I said, will be able to answer some basic questions, and then that will be a stepping stone to how things go. So yes, today the topic is cannabis. Whatever you want to call it, the words are interchangeable, but they are actually different, as you can see. All right, and I'm just going to talk specifically about MS and limit it to that. Okay, so actually this is an old player playing in a new field. Okay, and I said new field because things are coming out different. Going back, it has a long history. It has a long history medically and recreationally. So why all of a sudden everything is all about cannabis and marijuana and medical marijuana and THC and hemp? This is actually an old product that has been around. And some of the things that it has been used for has been centuries. You know, I was looking up spasms, and even early at the turn, 200 or 300 AD. Wow. Yes. And then epilepsy, it was mentioned in the 1800s. So it's been around for a long time. There have been reports that it was even BC. Yes. So this is really something that's really old, but now, I think it goes through a cycle, dies down for a while and then it comes up and everyone's hyped up about it. But in the 1970s, it became a Schedule I drug in the United States. So that means very restricted, not something that is not easily prescribed. Okay? So really, what is it? So you hear the word marijuana, cannabis, cannabidiol, and all these words, but they are actually quite different. So cannabis sativa is the plant that everything comes from. And there are very different species. Marijuana comes from the cannabis plant. Okay, and marijuana, the active compound is cannabidiol, but it contains high level of THC, tetrahydrochloride something, and many other compounds. So it's not only cannabinoids and THC, there are so many other compounds, and the variations of this plant are many. And I was looking at that, I said I could spend an entire day just talking about the different types of cannabis plant. But no, we are not growing it in Texas legally yet. So we're not going to discuss that. But it is very, very widespread and very, very has a whole lot of different types that you can use and that people can grow. Hemp is also a derivative of the cannabis plant as well. Hemp has very low THC levels, less than 3%. That is now legal in Texas. Okay, contrary to popular belief, it just became legal 2 days ago. Okay, it wasn't legal before. All right, so that's just a differentiation of the different types. The commonly used phrases are cannabis, marijuana, hemp, THC. And this is just a definition of how to use them. Okay? How is it used? So when, depending on the derivative of the plant that you're using, it can be smoke or inhaled through cigarettes, pipes, or blunts, or vaporizing. Yes, yes, it can be vaporized. Okay, so that's how it gets in the system through the respiratory tract. It can be oral. People make products, food products out of it, so they either eat or drink it. So now we're hearing Coca-Cola is going to put CBD derivatives in their products. I mean, come on, the Coke is enough, right? And you're going to add CBD to it? Yeah, so, and everyone's putting CBD. Kroger's going to carry CBD laced products. You know, people are, you put it in your coffee, but I don't understand that. Coffee makes you hyper, and then you putting this is going to make you a little bit lax. I don't know how that. But there are lots. You have ice creams, you have brownies, you have cookies, lots of oral forms that you can ingest this with. And then it can be used through the skin and tissue absorption. So people can use oils, they make oils and rub it on their body. Or it can be used as spray, oral mucosal, either in the mouth or in the nose. So these are the various ways it can be used. Okay? So I mentioned THC before, and it's a long chemical word, so we'll just stick with the acronym THC for now. It's the psychoactive component of the cannabis plant. Okay, so this is the one that causes the high, and you can be so high that you can be psychotic with it. What we do know about it is that it is a proconvulsant. So what does that mean? It has the tendency to promote seizures. Okay? That is the THC part of it. The CBD cannabinoid part of it is not psychoactive, so it doesn't make you high, and it's anticonvulsant, so it can be anti-seizure. And that's why when you hear about CBD used for seizures, it's very low in THC and high in CBD because they will counteract each other. All right, so those are the another two acronym you have to get used to. So so with marijuana, with cannabinoid, there are different types of uses. You can have the recreational use. We have an endogenous, and I will talk about that, and the medical use. This is what I'm going to mention about the recreational use, okay? It's still not legal here in Texas. It's legal in 9 states. Recreational marijuana is legal in 9 states, but not in Texas. And really, we're talking about the plant itself. There are many strains of that plant. You know, they have cannabis, whatever, but lots of strains of it. And it has very high amount of THC. So this is the one people get high on. They take it to get high. And they use it for recreational activity. Because of that, and the amount of THC can be between 5% to 75%. Depending on the high you want to get, you get the strain with the highest, or whatever your liking is. Okay? And then we have synthetic cannabinoid. something like the K2, which is now also banned in most, can you wait? Okay. So I will ask that you write your questions down, and I will take questions at the end for the audience, because this is going on the channel. So synthetic K2, that one, if you follow the news, was the one that was causing a lot of issues, a lot of hospitalization, and people getting sick and dying from it. But that is the synthetic one, and it can be laced with a whole lot of stuff, and it can have really bad side effects. Okay, so that's it for the recreation, and that's what I'm going to say about this. And just as a disclaimer, this talk is not to promote anyone to go and use this, okay? Okay, so endogenous. Endogenous means something that is internal to our body, inherent to our body, occurring naturally in our body. So when all of this started, we found out that we do have an endogenous cannabinoid system in our body. It is almost, you all heard about endorphins and all of that. It's almost like that system. There are lots of receptors in your brain and your spinal cord that is associated with this system. That system is involved in memory, learning, and the ability for the brain to make new pathways. It has other minor functions. And I emphasize minor because people can come up with excuses of why they have to do what they want to do, right? You know, it's anti-inflammatory properties, but that's not the major part. The major part is learning and memory, and you have them throughout your brain and spinal cord. So like any other system in your body, when you add something that works on that system, there are different effects that can come from it. Okay? And before I go to the next slide, I'll say, think about, you know, sometimes I tell my patients to take melatonin at night to help them sleep, because melatonin is the sleep hormone. But I also tell them, do not take it for a very long period of time, because we do not want to disrupt your natural sleep process. Because once you start ingesting it, it's going to change how the body makes melatonin and how your sleep pattern is involved. So it's the same thing. We have this system. It has its own response and what it's involved in. So when you ingest something that works on that system, you expect a change. So what happens when the endocannabinoid system is you start to use outside or exogenous CBD with it? Yes, you can have a feeling of well-being. Yes, that's a positive thing for it. But then it can also cause psychosis. It can impair memory and cognitive processing depending on the level of THC that is in what you are ingesting. It can slow down your movement. It can help sleep, right? So I'm listing all of this, and not all of, there are some good parts and there are some not so good parts. You know, for some people, they need some sleep promoting effects of this system. All right? Anti-nausea. So it can help with nausea, anti-spasticity, and anti-pain. And most people use this because they're saying, well, I have pain and I have spasticity, or I'm nauseated. So yes, this is the system. It's been proven biologically that these effects do occur when that system is involved in things. All right? But depending on the level of THC, once again, you can have effects that may not be good for your body. All right, so that was the endogenous, what is inherent to your natural system. Now let's talk about the medical part, okay? So, medical cannabis, the law has been changing in various states, but not at the federal level. So federally, it's still illegal. But at the state level, in different states, we have about 46 states, Washington, D.C. and Puerto Rico, that have medical cannabis law in effect. Texas, not yet. It's still sitting on the governor's desk, waiting to see if it can be expanded from intractable epilepsy to other conditions. Okay? And as I said, as of the 10th, he finally signed that hemp products, meaning less than 0.3% of THC, can be grown and bought in Texas. So whatever you were doing before Monday, whatever you were doing before, you were doing at your own risk. And one of my patients, when I came in today, she's like, well, it's legal now, so it's not going to go against your license. Because my favorite phrase was, I work in Texas, I have a medical license to protect, I cannot condone this. So now we can actually talk about it openly, because yes, we have this approved. This is approved for only intractable epilepsy, and now we're waiting to see, and we have until the 16th to see if it's going to be expanded to other conditions, with MS being one of them, because that has been lobbied for in Austin for the whole session. They've been lobbying for that. But in the different states, its indication is for MS, seizures, cancer, HIV. Those are the most common medical indications that you see medical cannabis being prescribed. And then recently to tell you that the tide is now changing. About 2 weeks ago, the Food and Drug Administration call for public comments. So they open up a forum and say, you have until, I think it's September, let's hear your thoughts on medical marijuana. And that's a step to say, okay, we're considering it, what is the public saying, and we're going to look at the data for that. Okay, so there is progress in this field to see if this can be changed at the federal level. Okay, but interestingly, while I said this has been around for a very long time, and you have 46 states that have medical cannabis law, no formal clinical studies on how effective this is has been done on any other product soon that is being sold in all the dispensaries that are out there. So if you go to states like Colorado, Washington, California, and get your cookie and get your brownie, there hasn't been any studies on how effective those are. Interesting, isn't it? I get a whole lot of flack from my patients. Dr. Okai, how long have this medication been out that you want to prescribe for me, and what are all of this? But, you know, we're going to get all of this. It's very interesting. Study has been done on other forms of cannabis-derived products that has been approved, but just not what we want to hear, right? So you have Marinol, Nabilone, the generic is Tronabinol, and that has been studied and is FDA approved for nausea and vomiting associated with chemotherapy and AIDS associated weight loss. So Marinol has been around for a very long time. So people who have difficulty with appetite and all of that has been prescribed. And chemotherapy, that's something that they do give to them. So yes, that is a derivative of cannabis, and it's approved. And then most recently in last year, there was another product that was approved for pediatric epilepsy, almost purely CBD, greater than 98%, to be prescribed for patients with pediatric epilepsy. Those have clinical studies that went through the rigorous trials to say they have been proven effective. But we don't see anything up here for MS, right? Well, at least not in the United States. Because in most other countries, there is this compound called Sativex, which has been studied in MS patients. It's an oral mucosal spray, and it's extracted from the cannabis plant. It has CBD and THC, actually. And it's approved for MS spasticity and pain and cancer pain. It's not approved in the US. Okay, so but those have studies that have been shown in MS to treat that and approved in other countries, about 20 plus other countries. Okay, so that's at the federal level. Okay, so what is the role of cannabis in MS? So there was an analysis done of all the papers that have been published on cannabis, and I say papers published. And the American Academy of Neurology, which most neurologists are part of, in 2004 came up with a guideline and said, based on all the studies, based on all the papers that we have looked at, this is what we have found out. If there's an oral form of cannabis, it's possibly effective. Meaning we don't have proof that it is effective for spasticity, and I'm starting with spasticity, but it is a possibility that it does help with that. If you use the oral mucosal version, it's a little bit higher, it's probably effective. But we don't have any clinical trials or evidence to say that this is effective, or probably 80% of the patient or 30% of the patient. All they can say is probably effective. Okay? And the smoked form, so if it's the blunt or whatever you're doing, we're uncertain about that. And as neurologists, we will not recommend this smoke form because we also have to think about all the other issues that come with smoking. All right, so that, and usually that is done recreationally, so there really aren't any studies to say that it helps with this, except what patients report. And looking at all the papers that they look at, for all those studies that they say is possible or properly effective, it was all patient reporting that it was effective. So one study like, okay, let's do our pain scale, let's do our spasticity scale and see if you change. So when you come to the office, we examine you and say, okay, your spasticity is on this level or this level. No, on all those objective things, there was no change. No change, but the patients reported, I feel better. So we have to take that for what it is, right? If the patient is telling me, look, Dr. Okai, I took this and I slept better, I didn't kick all night. Okay, your sleep is good. What can I say about that, right? And it was the same thing for central pain. For pain, when you look at any oral form of the cannabis derivative, it was effective in treating pain. And if you look back to a few slides that I had before, Remember I said your endogenous cannabis system is anti-pain and anti-nausea. So there is some scientific background on why this will work in pain. The oral spray is probably effective as well. And once again, the smoke form is unclear. Okay? But when they look at the pain scales, it was all subjective what the patient reported. They also look at bladder symptoms and tremors in MS, and it was negative. Really didn't impact that. Okay, so this is the guideline from the American Academy of Neurology. It's possibly effective. We do not have clinical trials that have proven it to be effective just because they haven't been done. There's been a federal ban on this compound. So we cannot say that you can take this and it's going to treat your spasms or your pain effectively. But there are some data that it could help with that. Okay. All right. So let's talk about the safety. So I went through what the drug was, how it's used, and its role in MS. And I'm treating it like every other drug. And for some of you who have heard me talk, I always talk about this phrase when I'm prescribing something for patients. The first question they ask is, what's the side effect? Right, so I'm going to talk about the safety and side effect of this drug as well, because my response to them is everything you put in your body, it has a side effect, including grass and weed, right? I mean, the teenagers were like, oh, it's just grass, you know? But no, it does have some side effect to it. So let's talk about that, all right? But before I go, safety. So all these dispensaries in these states that have a legal medical marijuana laws, they are providing advice about the product and what condition, you know, if you have spasticity, you want to take this, and this is, you take half a cookie in the morning or half a cookie at night, and this is how you're going to respond to it. But over 80% of them have no medical training. And once again, the products haven't been tested in any clinical setting. So that's something to also be aware of. And never studied in people who have used it. So it's saying, this is my recommendation, but the people who are using it haven't even reported back to say, okay, based on this large scale we have sold to 200 patients, this is what they're reporting spasticity, or this is what they're reporting pain. We do not have that information yet, okay? There may be some drug interaction with cannabis-derived product, believe it or not. You know, for people who are on certain blood thinners, for people who are on certain rheumatoid medications, there are several drugs that may interact with cannabis-derived product. So it does have some effect, just like everything else you put in your body. And then I put here contaminants. What is that? Because for those that are in dispensary, the products have to be processed, right? If you are using it as an oil, if you're using it as a spray, if you're using it as a edible product, it has to be processed from the actual plant. And in the process of doing that, you know, first, where they're growing it, how much pesticide is being used. You know, what kind of fungus or whatever is mixed with that, because whatever you're planting, you also have to think about other organisms that may be growing along with it. And then when they try to extract it, there are different methods of extraction. Some of them use solvents, butane. Now, when you think about butane, a chemical like that, just on its own, I don't want that in my body. But if they're using that to extract some of these products, you are getting exposed to it. You know, certain type of alcohol that they use as well. And then there's so far that I'm aware of, that in my reading, there's the molecular separation where there's not a whole lot of adulterants with it. But how do you know what process they're using when you buy that product? So that's something you have to be aware of as well. Okay, so now let's go to the actual side effects. And you all have seen commercial for drugs before, right? Talk to your doctor if you have dizziness, swelling, dry mouth, somnolence, disorientation, blah, 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 blah. I can go on and on and on about this. But yes, this is the same thing. Now, if I put that in a packet and I said, I'm going to give you a drug to treat your spasticity, but you know what? It's going to make you drowsy and you can't drive. Dr. Okai, no, I can't do that. I have to work and all of that. Or I will prescribe it and then the patient goes home like, oh, I read all the side effects and I decided not to start the medication. Well, look at the side effects associated with this. Doesn't it look like the same thing I would prescribe for you? Right? So it does occur. We just don't have a package insert to say, if you are taking a cannabis-derived product, these are all of that. Then if there are certain drugs like Dr. Okai, I don't want to become addicted to any drug. But yes, you can be a pothead, right? You can. There's nothing. I have a patient, the first time I saw him, which was years ago, about 7 years, he came and I'm like, what? He's like, he smoked marijuana. He's like, Dr. Okai, I'm telling you right now, I'm a pothead and you're not going to stop that. I said, okay, thanks for letting me know. So when he comes and he leaves, I just spray my exam room because by that time I'm like, oh. But he was upfront. He said, this is who I am. And I just had to accept that, and we had a good we have a good relationship. He said, I'm using this. I said, okay, as long as you continue to do what I tell you to do, then you can do that in combination. But yeah, this is the common side effect associated with the medication. Okay, and not everyone may experience it. Just like all your other medication, not all the side effects listed you will experience it, but they do occur. Okay? That's a good one. But let me take it a little further. So the neurological side effects. I talk about THC being a proconvulsant. It can promote seizures. All right? You can have vision change associated with these products. Impaired brain development. Okay? The human brain continues to develop until 25 years of age. And remember in my prior slide, I said the endogenous cannabinoid system is involved in memory and learning. Well, guess who's using these things? You go to the high school, or you go to the college dorm and you just walk down the hallway, you know where the whiff is coming from. You know it, right? But look at this. If they're still under 25, and it can impair brain development. And then attention, memory, and learning, right? So some of them don't even remember their college days, you know, however they got to them. But it does affect that. Once again, it may not happen to everyone, but that is a side effect that can occur neurologically. And believe it or not, I have seen people in the hospital with stroke and hemorrhage in the brain from this. Okay? And then that also goes back to what is your cannabinoid product being mixed with? Because you would like to think it's pure, But some people don't like it pure, right? They like other things with it. And that can promote stroke and subarachnoid hemorrhage and heart attacks, okay? Psychiatric side effects, I talked about psychosis earlier on. So in addition to psychosis, people with the tendency can develop schizophrenia. It can also cause anxiety, even though for most people they're chill with it. It can cause anxiety and depression, lead to suicide, and I talk about the addiction risk. All right? So neurologic and then the psychiatric part of it is something that we have to be aware of. And something, I talk about the drug interaction. It can also interact with steroids. Why do I bring that up? Because we're in a room full of MS patients who may need steroids every now and then. And if that is the case, and you're using this product, then we have to monitor for other things, stroke, you know, if the levels are being affected. Other side effects associated with the medication, well, we don't want you smoking while you're pregnant, and definitely we don't recommend smoking marijuana while you're pregnant. Low birth rate, maternal complication, and exposure of the fetus to the compound. For men, low sperm count. Here's a big one, liver injury. Most patients, how is this, with the medication, how is this going to affect my liver? Dr. Okai, I don't want anything that will affect my liver. But with the approved, FDA-approved cannabinoid-derived therapies, it's recommended that the liver be checked periodically and almost in the same frequency like I do my MS medication. So liver injury is something that also comes into play. Respiratory symptom, especially if you're smoking, chronic bronchitis, and then lung. Pneumothorax, where your lung collapse. Okay, so that affects patients. Well, here's a good side effect. Weight loss. Weight loss, that's a good side effect. And then it impairs driving. Okay? So when I was putting this together, I'm like, oh, this is no different from the other drug calls where I have to go through all the side effects and make the patients afraid before I tell them, okay, this is how the drug works and how good it is. Okay? But I bring this to light because it is not as benign as we think. There are some positive benefits, but we have to look at the whole picture when we are talking about prescribing this in the population. We have to look at drug interaction. What drugs are you on? Is it okay to prescribe this? And when you really look at it, the two main things in MS that cannabinoid really probably seem to help is spasticity and pain. The percentage of MS patients with spasticity and pain is less than 50%. But everyone wants to try this, right? But it's very interesting when we look at this statistic. There may be other benefits to it, but because we don't have clinical trials or clinical studies to say this is what it helps, we don't know at this time. We'll just rely on what patients are telling us. Okay, all right. So as I said, this was meant to be a basic lecture to start the conversation. At this time, and we'll know by the 16th whether in Texas we're going to have CBD products that can be prescribed for other conditions such as MS. But for now, they have a long history using multiple conditions, but very limited clinical data to support those uses. Still not legal at the federal level, But at state levels, you have the majority of the states passing medical marijuana laws. And probably with increased awareness, we have the potential for proper studies and uses to be performed. And then we can establish a guideline to say, based on the symptoms, based on what most people present with, this is what we will recommend medical marijuana or CBD for. And with that, I will stop because I know the most important part of any program is the questions, and that's what's on the slide.